This is the second part of the proposal presentation and focuses on impact and dissemination. There are three aspects here. A. Impact related to objectives, involvement of stakeholders, and C. Communication dissemination valorization. Just to recap the objectives, research coordination and capacity building, we are focusing on achieving good oral health for children through effective policy development, implementation, and monitoring. The impact will be on policy, society at large who are affected by the policy, improved capacity among experts, caregivers, end user stakeholders that will empower them to further improve health. And finally, there is an impact on scientific and technology advancement. Let's deal with each separately. Policy impact. At the level of policy, new or improved health programs can be developed through collaboration or further research and then can be piloted or implemented. A standard metric for policy evaluation suitable for EU will help us gauge the success of various policy measures across countries. The possibility of AI and ML in policy monitoring early on will lead to further improvements. The oversight by the Ethics and Equal Access Work Group will highlight areas that can deliver equitable access and care to all. So, in long term, strengthening of policy will improve the outcomes based on a continuous and iterative feedback. The training modules, course curricula for capacity building of the stakeholders will lead to long term success. On the societal impact, the impact will vary among countries based on the prior accomplishments in oral health. Some countries have highly improved healthcare system and are focusing on further improvement, while other countries are overwhelmed by high disease burden. Thus, the impact will be different but positive. Better access to care. The cost efforts will identify barriers to care in context to the participating countries. Improved access at all levels will bring down the disease and its negative effect on the society. On improved equity in care, urgent needs compete with essential non-urgent needs. Balancing both type of needs is essential for long-term benefits. Prioritizing urgent care and sustained essential care in a balanced manner will bring equity, relying on the available resources and its optimum utilization. Empowering communities. Engaging the stakeholders who form the communities in identifying problems in care, access, and equity will create a grassroots driven roadmap to better children health. So, in long term, stronger, inclusive policies through stakeholder participation will ensure sustained equity based accessible care and hence reduced disease burden. Impact on capacity building and knowledge transfer will be noticeable. Researchers, especially early researchers, will have opportunity to work on country specific and ground reality research that impacts children's oral health. Clinicians and public health experts who directly work on health outcomes will have access to cutting edge innovation and best practices derived from ongoing research and established protocols from successful countries. Policymakers will be highly responsive, with real time data and analysis being available and interpreted in light of other countries' experiences. Community leads, including political leaders, teachers, NGOs, will be better equipped to identify local problems, raise awareness, advocate, and support the health seeking stakeholders. The long term impact will improve the public health expertise, including among the end user stakeholders and their public health experience. Scientifically, a robust understanding of how oral health policy influence dental caries, the childhood dental caries, and its management becomes available with cross-country comparison using standardized methodology for evaluation. On the tech side, the use of advanced tech will allow real-time monitoring, comparison, predictive modeling for effective policy planning, implementation, and in-process modification. Involvement of stakeholders. At every stage of the cost action, engagement with the various stakeholders is important. For researchers, they have access to For example, for researchers, they have access to transnational comparable data sets for collaborative research. Clinicians and public experts, health experts, co-design policy interventions. Policymakers have access to evidence for a better informed policy. Civil society and advocacy groups lead their empowered voice in health decisions. Tech and industry partners participate in public private consortium. Healthcare systems lead the co creation of workforce strategies. Communication strategy. The main objective of the communication is to raise awareness and engagement to cost action, their aims, and create opportunities for participation. All stakeholders are to be reached as they impact the cost action work. They will be reached using various channels frequented by the stakeholders, having content designed specific to different stakeholder interests and needs. Thus, the awareness and engagement will also be increased. The outcome will be assessed by using suitable KPIs. In the dissemination strategy, the main objective is to share results, developed tools, and knowledge generated by the cost action in an accessible, transparent, and equitable manner through open access, freely available platforms. Stakeholders are primarily researchers, clinicians, policymakers, and tech partners who will have access to high quality, actionable knowledge and tools. The outcome measured by research outputs, tools and resources used, citations, and feedback. In the valorization strategy, the objective is to ensure that the cost action outputs are applied in practice, maximizing societal and policy impact. The stakeholders here include the policymakers, clinicians, civil society, technology partners, parents and guardians, and healthcare systems. The activities include piloting, implementation of policy recommendations, having training sessions, conducting workshops, community engagement programs, and technology deployment. The outcome include tangible improvements in childhood oral health policies and its services and the community practices leading to reduction in the childhood caries burden. This is the end of part 2. The third and final part is on implementation. Thank you.